WCC, Asher. I'm Regional Director with CHE Behavioral Health Services. So I manage the psychological services in the area along with Dr. Joanne Shea. Do you guys know how many psychologists you have on site? That's right. Okay, you do have 3 psychologists. I hope you know them. Dr. Mayo, Dr. Schultz, and Dr. Reese also, or Rice. So I was asked to present on behavioral management, so how to deal with difficult behaviors, and in particular as they pertain to dementia, patients who suffer from dementia. My recollection is that you have a dementia unit in this facility, right?
Yes.
Okay, how many of you work with patients who have dementia? Okay, great. So I think I'm going to be back again. Does anybody, I was here last year as well. So I offered to present pretty much the same presentation, so you'll probably remember it from last year. Anyways, so I'll be back for a follow-up to focus more specifically on dementia. But today is going to be more an introduction to behavioral management, okay? The first thing I'd like you to pay attention to here is the screen. So does everybody see the screen? Just quickly tell me what comes to mind when you see the screen. What words come to mind? Serenity. All right, correct.
Vacation.
Those are, that's usually I'm looking for those words. Calm, serenity, tranquil, relax. Every once in a while I get a funny response like UFO or impending doom, but you get the right idea, tranquility. And even if you look at the picture for long enough and you kind of imagine yourself there, you might even start feeling a little bit more relaxed, like your shoulders start releasing some tension. It would be really nice if work in long-term care resembled that, right? Resembled the tranquility. Where, like, let's say you're a nurse's aide, you show up, you knock on the door of your first assignment, and you're like, "Good morning, Mr. Smith, time to get up, get ready for therapy," and he like swings open the curtain and says, "Already dressed, already showered, ready to go." Like, it'll be really nice if it was that easy, but we all know that work in long-term care is not that easy and it's very stressful. And this is just like a representation of that, right? Sometimes it feels like you're in a black and white photo with dental equipment down your throat. Sometimes, not all the time. It's really stressful, we all know that. And part of what makes it stressful is that we're not always working with patients who are willing participants, who are necessarily interested in cooperating, right? And these are human beings under a lot of stress. That makes our jobs really difficult. And the better we get at finding ways to address the behavior problems, the truth is our jobs will be a little bit more pleasant. So the key is we'll discuss some very basic approaches to developing appropriate and effective tools for managing difficult behaviors. What I'd like to ask you is, for every, let's say, 10 residents that are admitted to this facility, how many of them might exhibit a behavior disturbance at some point in their stay, like aggression, non-compliance? 10. 10 out of 10. Okay. I'm not talking about staff, I'm talking about residents. Do you think 10 out of 10 residents are admitted? Yeah. Okay, so obviously what that tells us is that we know it's very common. So the stat that I have from the research is about 80%, which is kind of what we expect. My second question though is, how many residents of planet Earth exhibit a behavior disturbance at some point in their stay on planet Earth?
About 6 billion.
Okay, so the answer is 100%, right? 100% of human beings exhibit a behavior disturbance at some point in their stay on planet Earth. Now, I know you guys are thinking like that's a ridiculous thing to say, because everybody here in their own mind, you don't have to share, but you probably had a couple behavior disturbances today, right? Just today, one day on planet Earth. And the reason is because human beings, maybe before work, maybe at work, right? Maybe right now. So the truth is human beings are complex, right? And especially when human beings are undergoing a lot of stress, we tend to behave in some unpleasant ways at times, right? We can be irritable, and we can be nasty sometimes. The reason I point this out at the beginning is that the foundation of learning how to manage difficult behaviors is being able to empathize, being able to put oneself in the resident's shoes, right? For some reason, when we work in long-term care, and I include myself, because I work in long-term care, and I was a psychologist full-time in nursing homes for a while. What happens is we see behavior disturbances as something different. Like a patient is yelling and we ask ourselves questions like, hey, why is he yelling? Or why is this patient so demanding? As if like human beings don't usually act like this, right? It's just in long-term care. This guy seems to be deviating from the norm. We know that that's not true because in our day-to-day lives, people behave in all funny ways all the time. Additionally, we end up at times defining the patient by their behavior problems, right? Let's say the next shift is coming on. I'm going to introduce the next shift to the patient by saying, hey, you got to be careful of Mrs. Jones because Mrs. Jones is what? What do we call her? A behavior, right? She is a behavior. But in our day-to-day lives, we don't usually do things like that, right? I don't say like, hey, this is my wife, Jen, she's a behavior, right? I don't say things like that. None of us do. We all know she might have some behavior problems, like we all do, but we don't really see it in the same way. We don't see her as this behavior problem. So if we're able to kind of take a step back, and that's really, I think, the foundation for dealing effectively with this, to realize that these are human beings and behavior disturbances, it's not the exception, it's the norm, and we all know that. So it'll allow us to empathize a little bit, and if we're able to empathize and like be a little forgiving of the patients, we'll be able to then use our minds to try to find ways to help them. So in the interest of time, I'll be skipping around a little bit in the slides. The first thing the second thing I want to discuss is, very briefly, why is it so relevant? So we've already pointed out that behavior disturbances among the residents is something that frustrates all of us and makes our work very difficult. Additionally, we all know, especially if you've been working in long-term care for, let's say, 20 years or so. Anybody here been working in long-term care for 20 years? Okay, so there's some of us. So you know that the population has been changing. And I don't know about this particular nursing home, but in a lot of facilities, you have younger patients with more psychiatric histories and more behavior problems, more aggression. So at the same time, we know that regulations are having us wean patients off psychotropic medication. So back in the day, for better or for worse, usually for worse, if a patient is getting aggressive or agitated, they would just sedate the patient. And no more behavior problem, and sometimes no more patient either, which was a problem. We don't do that anymore, and therefore we're kind of stuck. It's like a catch-22. More behavior problems and less reliance on medication. So that's kind of the basic rationale for why this is so important to discuss. With appropriate intervention, we're going to be able to, of course, improve patient quality of life, improve family satisfaction, because we all know the family shows up on the unit and says, hey, how come my father hasn't showered in 2 weeks? But we all know it's because he doesn't let anybody into his room. Forget about being willing to shower. So if we know how to deal with non-compliance better, families will likely be more satisfied. And in general, it leads to more effective teamwork, etc. So let's just kind of jump into the nitty-gritty. Here's some examples of some behavior disturbances we all know. I bet if some of us are at the end of the shift, or towards the end of the shift today, you can probably offer a couple examples of a patient who's yelling, or inappropriate, or overly demanding, and things like that, right? This is commonplace. Let's take it for instance. Let's say I had a really bad day at the nursing home, and every patient yelled at me. Let's say 10 out of 10 patients, accused me of being the source of their problems and gave me a really hard time. So, did that happen to you today? No. So you're gonna go home tonight, right? You're gonna have a cold drink, and let's say you went on Google and you're like, things to do for patients who are yelling at me at the nursing home. So you're probably gonna get 500, 600 million responses. You'll hit all those websites. You'll see videos like YouTube how-to videos on how to deal with patients who are yelling. And you spend a couple hours, compile a list of 200 interventions, and then you come in the next day you're all psyched, I got this. And then the first person yells at you, and you're like, okay, hang on a sec. You consult your list, and you try intervention 1. You're like, okay, and you go for number 1, number 2. So we all know this is a ridiculous and ineffective way to deal with behavior problems, right? Why? What's so bad about that? Okay, yeah, exactly. So everybody's different, and also the reason why she's yelling today is not the reason she yelled yesterday or 10 minutes ago, right? So we all know that, and we know this from our day-to-day lives. Does anybody have a baby, for example? If you have a baby at home, and let's say you're out, and the baby's with a babysitter, and the babysitter calls you and says, hey, the baby's crying. So even if you're a new parent, you're not going to go on your phone and say, what to do when a baby's crying, right? And then tell the babysitter, okay, try this, try this. we all know that's not really what we do. We know our babies, we know our kids, so we're going to ask some pointed questions. Well, I know my kid likes this, and she likes this, and she has to be put like this in the bed. So I'll ask some pointed questions to determine what the issue is, and then the intervention is the easy part. So the key is, when it comes to behavior interventions, if you want to deal with a behavior problem effectively, the key is not memorizing skills, it's not necessarily learning new skills or learning new techniques. The key is really being very, very good at determining what the problem is. Because once we know what the problem is, the solution is the easy part, okay? So essentially, what we're trying to do is we're trying to be a good detective, right? Which means, whatever you do in the nursing home, whether you're in social services or you are a nurse's aide or whatever you do, in a moment when you're trying to intervene and try to come up with a good approach to the behavior problem, you have to be a good detective. You have to determine what the reason is. You have to determine what the trigger is. We'll talk about a couple ways how to do that, but essentially, the better we get at identifying that, the interventions will be the easy part, okay? So the basic approach to behavior problems is, I'm a detective, I'm going to try to figure out what the issue is. There's always a reason, there's always a trigger, even if I don't like it, okay? You might disagree with the patient's perception of things, you might think it's distorted, they might have severe cognitive impairments, so you're like, you know, they're totally in a different world, they don't understand this, but you have to respect the fact that every behavior, good or bad, has some kind of trigger. If you're a good detective, with a patient, if you're working with a patient who has good insight, or moderate insight, and able to communicate well, or moderately well, then you'll probably ask why. Why don't you want to take your medication? Or what's bothering you right now? You'll start by asking questions. And the really good thing about asking questions and being a good detective is that it communicates something else to the patient. What do you think it communicates to a patient if we say why, if we show that we're interested in her experience? That you care, right? And the crazy, ironic thing about human beings is that human beings in an institutional setting, human beings, let's say in a nursing home or a hospital, for some reason, even though they're surrounded by people whose job it is to provide care, they always feel that nobody really cares, right? Everybody's just here to make some money, they're just doing their job, they just don't want to get fired, and things like that. It's very stressful to be a resident in a nursing home, obviously. So when we demonstrate that actually we do care, that itself can be a really good intervention. And we also know this from dealing with other people in our lives, maybe, or dealing with children as well, like in schools. So if a kid is acting out, sometimes all it takes is for a caring teacher or staff person to show that he or she is interested in his or her experience, right? And sometimes the behavior improves just from that. So part of being a good detective, while we're trying to figure out what the trigger is so we can implement a good behavior intervention, along the way we'll see that just showing interest in the patient goes a long way. Now sometimes we can't rely on just asking the patient for you know, the reason, right? Sometimes we work with patients who don't have good insight or who can't communicate well, like patients with dementia. So we have to be a little bit more, our detective work has to be a little bit more involved, right? We have to be sensitive to the needs that anybody has, like if they're hungry, if they're thirsty, things in the environment. We've all been in situations where, let's say a group of residents are eating in a cafeteria and a patient starts complaining about his broccoli. He's like, I can't believe they served me broccoli again. I'm allergic to broccoli. And he gets like a little bit agitated. So let's say they're patients with dementia who are around there in the same area. So what do they see? Do they understand that, oh, he's just complaining about his broccoli, everything's cool? No. Often, all they know is the nonverbal cues, right? All they know is that they don't understand the broccoli situation. They just know that something's wrong in the environment. Something's wrong. It could be a fire. It could be a terrorist attack. They have no idea sometimes. So environmental factors like agitated residents in the environment are something we have to attend to, and they can be the triggers for the behavior problem. When working with patients with dementia, what's critical is sometimes what comes even before the detective work, we try to avoid escalation. We try to avoid the problem at the beginning. Because it's very hard for patients with dementia to soothe themselves, and it's very hard for us to soothe them. We all know, we've been in that situation where all of a sudden she's getting agitated and it's escalating, and she's threatening and raising her fist, and at this point it's like, oh boy, like I'm not quite sure what to do. We try different things like distraction and things like that, which hopefully work, but the key when working with patients with dementia is try to anticipate what might be a trigger and to try to avoid that going in. So in being a good detective and trying to find those triggers, we try to look at the needs and whether they're being met or not. We also try to look at what comes before the behavior as well as what comes after the behavior. So what that means, just a basic example is, imagine that a patient was admitted here like a couple of days ago. And day one, she refuses her medication. So what happens? Hopefully, the nurse who's administering the medication, she takes a deep breath, she puts herself in the resident's shoes. This is a human being under a lot of distress. Let me try to help her out. She asks a question, well, how come you don't want to take your medication? Or is something concerning you by your medication? So she does her best to counsel her, but she refuses. Day two, she refuses again, and now the nurse tries to counsel her, and she invites the nurse manager on the unit into the room to help counsel the resident. Day three, what happens? She refuses again. So now social services comes in. Day four, director of nursing comes in. So what's the consequence of the behavior? She's not complying with the medication, right? What's the consequence of that? What happens as a result? Attention. Yeah, exactly. She gets attention. She gets a bigger party in the room every time she refuses medication. It's a pretty easy formula. So sometimes what comes after the behavior is what's maintaining that behavior, is what's strengthening the behavior. We'll talk about this at the end as well. How we can use that to our advantage. The key is to ask a whole bunch of questions. You can't see that, but the key is to ask a whole bunch of questions to be a good detective. Better we are at being a detective, better we'll be able to find the intervention that works. So once we take a step back and think about the situation of a human being in these circumstances, there are a lot of common triggers and common reasons for behavior problems, things that really set the stage for the problems that we all see. We'll run through them quickly. One is the obvious. Patients are admitted, they have medical problems, it's not their environment, so they're maybe not eating the food they're used to, they're not sleeping as well. Those things certainly can set the stage for some behavior problems. As we go through these, think about it like in your own lives, like in your brain for a second, go on a little trip, and think about a situation where you go to sleep too late one night, and you wake up too late in the morning, and you don't have time for breakfast, nor to pack lunch, and you show up at work hungry and tired, right? And be honest with yourself, does anybody want to be in your vicinity under those conditions? No, right? Nobody wants to be around you, because that's a human being under stress, and we're likely to be irritable, not so pleasant to work with, etc. So that's just the beginning, because patients in facilities such as these often are experiencing depressive symptoms. Like 50% maybe of patients that are admitted to facilities such as these feel some kind of depressive symptoms, which includes some of those: low motivation, hopelessness, etc. If anybody here has been depressed ever, or you know someone who has been, you know that you don't really care about taking care of yourself, you don't care about being polite, you don't care about life, you're hopeless. So that can definitely set the stage for some behavior problems. Of course, dementia as well. One basic example that I did when discussing dementia is another experiment in your brain. I'm having to do a lot of experiments in your brains, right? So check this out. Think about when you woke up this morning, the moment you open your eyes, and it's a brand new day, and all of a sudden, some guy comes into your room wearing a mask, and he rips the TV off the wall, and he leaves, right? How would you feel in that situation? How would that make you feel? Scared? Like shocked? It's ridiculous, right? That stuff doesn't happen out here on the island, right? So that's ridiculous. That's a crazy situation. So now, put yourself now in the shoes of someone with dementia. Now, if you ask a patient with dementia, you go to any patient here who has dementia, where are you now? What might they say? Probably. What?
I don't know.
I don't know. My house. Yeah. So basically, they'll say anything but West Hampton Care Center, right? They might say where they used to live, where they lived as a child. I'm in my house, I'm in my apartment. Maybe at best you'll get I'm in a hospital, or maybe you'll just get a blank stare, depending on the stage of dementia. But one thing, so they're not going to say I'm in a nursing home. So what happens in the morning when she opens her eyes and someone goes into her room and takes her clothing and walks out of her room? And we all know this person is coming there to launder her clothing, to help her out. But in her mind, she's like, someone just broke into my house and stole my things, right? And that's So imagine living with that kind of mistrust and fear. You're already set up so that anything goes wrong, things can escalate very, very quickly. So again, when we're working with patients with dementia, we have to be sensitive of this from the onset, from the beginning, before I walk into the room. And through nonverbal means, right? Not necessarily communicating verbally, but with gestures, looking the patient in the eye, demonstrate we are here to help, you're safe with me, I'm here to care for you. And then we're preventing this from the outset. It's really critical that we attend to that when patients with dementia, because we're seeing that it's among the things that can really trigger some nasty behaviors. Environmental stressors. Despite how home-like we try to make the environment, it's not the residence environment he or she's used to, and there are a lot of things that could be distressing. Adjustment difficulties. So anybody who's admitted here is going through a whole bunch of adjustment problems, right? They're, depending on their age and their situation, their work can be interrupted, their family life, all of a sudden they can't do the things they're used to, and that could be a lot of stress. So as we go through these things, we're noticing two things, right? They're kind of the two principles that we're trying to discuss today. Empathy, which means that, wow, this is a human being that's undergoing a lot of stress, way more than just being tired and hungry. So that allows us to have the space to say, you know what, I'm going to try to be a good detective. And the truth is, the better we get at empathizing, the better we get at putting ourselves in the resident's shoes, the better we get at being good detectives. And if we're good detectives and we learn about what's triggering the behavior problems, we can then empathize better. So these things kind of work off each other. Guys, this is stuff that, of course, we use in our day-to-day lives, and we could take this to our day-to-day lives, because we deal with people with behavior problems all the time. Conflictual interactions with spouses, with children, relatives, friends, people on the street, in stores, whatever. And the better we get at being patient, investigating, the better we get at understanding their situation and intervening effectively. So the key is to get that cycle in motion and to individualize assessment, right? Every situation is different, so investigate that particular situation and you'll come to effective intervention. So we can give a couple examples. I have an example here of non-compliance, but I'd like to maybe do this one, agitation or aggression. So there are a lot of reasons why a patient might become aggressive or might get agitated. It could be, and the key, I guess, why we're looking at this is because depending on the trigger, that's the principle we're discussing, right? Depending on the reason, the intervention will be according to that, right? So if it's overstimulation, you can remove or reduce the external stress, bring the patient to another situation. Especially with patients with dementia, right? The stimulation it's not like, it could be excited stimulation, right? Things are going really well in the environment, people are really excited, but he or she might not interpret it that way. They might not understand the content. They might just see that there's a lot of excitement and they might get concerned and aggress or become agitated. Sometimes it is a matter of fatigue or pain. So finding ways to provide rest times or pain management can be an effective intervention. Cognitive impairment. So when a patient with dementia is getting agitated, it could be because they just don't understand, right? You're trying to ask them to cooperate, you're trying to provide care, and you need their help, but they just don't understand. And they don't understand, they get worried already. Their baseline, like we said before, is already, they're kind of at the threshold where they don't know what's going on in the environment and they can easily snap. So what's critical is that we break things down into bite-sized pieces and do our best to communicate in nonverbal ways. And do our best to not argue her or him out of his or her misconception of things, right? We never want to, if a patient with dementia is getting agitated, we never want, for example, I never see my family. We know that her son just walked out of the room 5 minutes ago. But of course it's a bad idea to say, actually, you're wrong. Because we can see him on the camera, look. That's a bad idea because we're never gonna argue him or her out of that misconception. The key is to provide comfort and to understand that it's a misunderstanding that is triggering the agitation. Let's just try our best to provide a soothing kind of response so that she can just calm down. That's essentially what we're trying to do. when it comes to any kind of behavior disturbance, like the example of refusing a shower or refusing care, the key is identifying the trigger, and then the intervention is the easy part. It's not about memorizing interventions. We only have 2 minutes or so left, so what we're going to do is as follows. This is the person whom I was talking about before, by the way, just so that you guys know. Okay, so I think the basic messages are clear. Empathize and investigate. Be good detectives. You'll come to the interventions that you're looking for. The final thing I want to discuss goes back to that new admission who's refusing her medication, right? We all understand the situation. She gets attention every time, she gets a party in her room every time she refuses medication. So one thing that I'm sure makes sense to everybody here is that every once in a while, or periodically, I'm asked to do in-services. And nobody calls me to do an in-service on good behaviors. They never say like, hey, Dr. Asher, we have all these good behaviors in our facility. It's amazing. Can you come and train the staff on how to deal with the good behaviors? Like, nobody says that to me. And it's just uncanny. Like, nobody's ever said that to me. And there's an obvious reason, because a patient who's behaving in a way that's cooperative and not really demanding intervention won't get intervention. There's nothing to intervene on. Everything's cool. It's like the kid in the classroom is quiet. Like, nobody's really gonna deal with the child. You know, we have limited resources. We have to allocate our resources to the patients or to the students who are disrupted. We gotta figure out interventions. So what happens in those moments then where it's like a quiet moment on the floor, on the unit, and like the person who usually yells is not yelling, and the person who's usually demanding is not demanding, and the person who usually doesn't take her medication took her medication, and nobody's ringing the call bell, the incessant call bell ringer is not ringing the call bell? It's like, wow, this is the ideal job. This is like Eden. This is amazing. Imagine in those moments, what would happen if you gave attention to the yeller who's not yelling? Like, you just walk to the room and say like, hey, what's going on? And you talk to the person, you stop by the room of the person who took her medications, and you said, it was so great to work with you today, thanks for being so cooperative. What would happen if we gave attention to the good behaviors? What would happen is, just like giving attention to the negative behaviors often strengthens those, and you'll get more and more negative behaviors, so too, giving attention to the positive behaviors will likely strengthen the positive behaviors. So I have a pretty slide for that. Water bad behavior, and you will get weeds. If you give attention to the bad behavior, you're going to get more and more of it. And if you give attention to the good behavior, you're going to get more and more good behavior. Okay, this is a critical life lesson. You don't need me here to teach you life lessons. But we all understand that it's a more pleasurable life when we're looking out for good things in our environment rather than bad things, right? We show up to work and like we're just kind of looking around, you know, attending to those things in the environment that are disturbing. It's not such a pleasant way of being, right? If we try even for 10 or 15 minutes on the unit to pay attention to the good things, we'll see more and more good things, and we'll actually be strengthening the good behavior. And this really works, right? This is the basics of like human behavior, or not just humans. This is the way they train dolphins also. So if you're thinking of switching professions, you'll know what to do. So in conclusion, I'm hoping that this discussion brought to our minds, even if we're talking about stuff that's intuitive to some of us, kind of brought to our minds the notion that human beings suffering behave in poor ways at times. Empathizing with the resident, and then being a good detective will hopefully lead you to good interventions. Thanks for coming.